All right, we're going to get our workshop started here at 5 p.m. on someone's clocks around here. Call to order and declaration of a quorum, 6 members present with 1 to attend shortly. And item C, hearing of citizens. Do we have anything? We have nothing. That brings us to item D1, consideration and discussion regarding employee health plans for 2022-23. Mr. Martindale.
Thank you, Mr. Warwick and board members. This will be considering approval to move into an agreement for employee health care plans for 22-23 is an action item at our regular meeting at 7 o'clock. However, we have an in-depth presentation for you here in workshop, and it looks like we got the trifecta here, the 3 musketeers going to share this information with us, a tremendous amount of work through the course of this year, culminating in an RFP that we'll be sharing this evening. So with additional information, we have Molly Perry, our Chief Administrative Officer, Amy Draws, our Chief Financial Officer, and Bob Tracy from Gallagher.
All right, thank you, Mr. Martindale. I'll kick us off this evening and start with a little bit of an overview of what has brought us to this evening to discuss where we intend to head in the 22-23 plan year with our healthcare options for CSISD employees. So as you probably recall, Senate Bill 1444, which was part of the last legislative session, the 87th session in Texas, provided an opportunity for districts across the state who were part of the TRS active care system for their active employees' health plans to opt out. Previously, once a district had opted into TRS, under state statute, there was no alternative to leave that program. You may recall we started seeing under District of Innovation some districts offering side-by-side plans, and while we were interested in that, we were also concerned that the state may close that loophole, which they absolutely did as part of Senate Bill 1444. And so as soon as we knew that this would be an option for us, we began an exploratory process and the Board of Trustees chartered a committee for us to really evaluate whether this made sense for College Station ISD. That committee met 3 times in the early fall and provided the direction we needed as an administration to say, yes, we want to push forward and really proceed towards opting out with the caveat that we needed to do some additional research and really make sure that this decision made sense for our employees and would be most beneficial. So one of the really important considerations there was the increase in cost. In the 21-22 year alone, the average increase for those TRS plans was 8%, which is substantial. And we have seen over 100 districts opt out since that time, with the deadline being December 31st. There'll be another opportunity next year, so there may be more to come. But additionally, we found in an analysis of our rates over the prior 3 years that the district was expending significantly more, in fact, just about $1.6 million more over that 3-year period than we were receiving back in benefits. And so with those considerations, you all, the Board of Trustees, took action, and we did notify TRS of that decision to opt out by the deadline of December 31st. So that brings us into the spring. With the assistance of Gallagher Consulting, Mr. Tracy here, we engaged in an RFP process. We released that RFP on February 23rd. We accepted questions from any interested individuals or entities until March 11th, and then those responses were all due by March 22nd. It is probably worth noting that anyone who had expressed interest in our business with health plans, we notified directly. We really wanted to make sure that anyone who might want to engage in this process with us had the opportunity to. And we were also interested in seeing both fully funded and self-funded plans, and so that was clearly delineated in the RFP. So here you can see the evaluation criteria that we used once we received those bids back. The greatest weight was placed upon purchase price with a 30% weight, looking at those overall premiums, fees, as well as the aggregate attachment composites. The next two highest weighted areas included quality and effectiveness of the vendor's goods or services, as well as 25% for the extent to which the goods or services would meet the district's needs. Next in weighting was 15%, and that was the reputation of the vendor goods and services. And lastly, the vendor's past relationship with the district was given a weight of 5. So these criteria were used to evaluate the responses. We did receive 3 proposals back in this process of RFP. You might think to yourself, wow, just 3. And we were actually a little bit surprised by that initially as well. However, after really going over that with our consultant, it became clear that the data that we received from TRS and were able to provide potential entities was very much incomplete. For example, there was no information related to Baylor Scott and White plans. There was no information related to prescriptions as well. And so we feel like our responses were somewhat limited by the fact that we do not have great data available from TRS. In the future, that will look very different though. So we did receive those 3. The first was Baylor Scott and White. That was a partial proposal because it was HMO only. The TML Health Benefits Pool, or the Texas Municipal League, otherwise known as TASB Health, did provide a complete proposal with both fully insured plans, including PPO and HMO, as well as United Healthcare. And so moving forward, we evaluated these options. So the highest cost-benefit value was really what we looked at initially. We did eliminate consideration for the Baylor Scott and White plan simply because they were only offering HMO, and we felt like that was too limited for our pool of employees. The TASB Benefits Cooperative and United Healthcare were both rated highest overall value in that bundled style ranking, but ultimately TASB Benefits did receive the highest score based upon the criteria that we discussed on the previous slide. And so at that point, after scoring, we engaged in a best and final offer with TASB Health. So as a reminder, we did talk a little bit about TASB Health as a possible option back in December. This is a nonprofit risk pool, similar to TRS in that it's governed by a board of trustees. It's a fully funded plan, meaning that we will not be doing the bulk of the managing of the plan like we would under a self-insured option. And that's tethered to the Texas Municipal League, which currently is including 900 local government entities across the state with 35,000 employees, although I have it on good authority that that's going to be growing over the next few months. So those rates and plan options are very comparable to what we have with our existing TRS Active Care. We'll look at a detail of what those plans are in a moment. And there are actually more types of options. With TRS Active Care, we are provided the options and we really have no flexibility in making any kinds of adjustments or requests like we do with TASB Health. We are very excited about the continuity of care aspect of going with TASB Health. They are a Blue Cross and Blue Shield program, which we currently have with the exception of the Baylor Scott and White Health HMO. However, the great news is that any of our employees who currently utilize Baylor Scott and White Health will be able to continue with their same providers regardless of which of these plans they select. And so there will be good continuity for all employees. We do have similar benefits available, such as telehealth and employee assistance. And as you'll see on subsequent slides, the prescription benefits are much improved over what we've experienced with TRS. So we're going to look at this first slide, and I'll take a moment to acclimate you to what we are seeing in the columns. You do have in front of you a printout if you'd like to be able to look a little more closely and or mark up the page. But we are going to look at this as a side-by-side comparison. I think it's natural when you're making a transition to something new to want to really see how does that compare to where you've come from. And so those first two columns going left to right include the TRS Active Care 2 relative to the TASB 1500 plan. So you'll see the plan options listed from the top down, and then in the bottom section of the slide, you can see the estimated enrollment. So one of the first things I want to draw your attention to is that we currently only have 37 employees enrolled in this Active Care 2 plan. And the reason for that is that TRS closed enrollment to this plan a number of years ago. And so no employees could elect to this plan, even if they were new to the district. It has been completely closed. This is what you would consider a gold level plan. It's got the lower deductibles, the lower copays, higher coverage. And so this has not been a plan that our employees have had the option to participate in unless they were grandfathered in and a part of that for many years. Under the TASB copay 1500, which is the next column over, which is most comparable, you can see that this plan would be open to any of our employees. It does have a little bit higher per person individual deductible. However, the out-of-pocket maximum is lower, the specialist visits are lower, the prescriptions are all lower. The urgent care is a little higher. You can see they're going from 50 to 75 per visit. So that is the first plan. Any questions before we continue on in terms of the layout of the information? All right.
So any employee or that's eligible would be able to get this particular plan?
Absolutely.
Okay.
Absolutely. This would mean likely that number 37 will change because this has not been an option for our folks. And so the estimates that we have here are based on current enrollments, but we know that folks will have the opportunity and likely make some adjustments based on these new options that are going to be available. So the next two columns on the right are our high deductible plans. So you can see right away, relative to the first one we looked at, 682 employees are enrolled in that high deductible plan. We've seen a gradual shift of more and more folks moving in that direction over the last several years as costs have risen. And one of the nice benefits of this plan is that you can, as an employee, create a health savings account that rolls over. It's not like the plans of the past where you would have to spend that money or lose it. And so you can really create your own plan in terms of how much you're contributing in addition to the plan cost itself. And so we are offering a high deductible plan under TASB Health as well. You can see the deductibles are the same. However, the out-of-pocket max is lower, the co-insurance is lower, the specialist visits are a little lower. The only things that's slightly higher is the telemedicine aspect within that high deductible plan, but otherwise everything, including the prescriptions, is an improvement over the TRS Active Care high deductible plan. All right. So we have 3 more comparisons, but actually 2 more plans with TASB Health, and I'll explain that as we move along. But the first 2 columns on this chart are in-network coverage only. So the plans we looked at on the first page are traditional PPO plans, and these are in-network. So with the Active Care Primary Plus, that one's a mouthful, the most comparable plan that we would be looking at under the TASB plan is the Blue Essentials 1500 plan. And so you can see the comparisons there are just slightly higher for individuals. Annual deductible, out-of-pocket maxes are a little over, not by much, but a little over what we would see with the Active Care Primary plan, but improved specialist visits, copays at the ER, and prescriptions. The middle column, yes,
Quick
sir.
question. So as we're comparing these, we're comparing the TRS plans and their cost relative to right now,
Correct.
not what we have no idea how they'll project out next year.
It's a very important point.
Okay.
We are comparing existing current costs relative to next year's costs with TASB Health. These are the 22-23 plan year costs for TASB Health. We do fully anticipate that TRS rates will increase. We don't yet know by how much, but the fact that we are seeing improved coverages when comparing current year plans to next
Remind me,
is
what did
certainly a
TRS
benefit.
go up last year for employees?
8% last
Okay.
year. And they are moving to regional rating with TRS, and so it will vary depending on where you are located within the state, how much you will see as an increase as a TRS active care participant.
And we're in with the Houston region, is that correct? Is that what I remember?
So they're doing it actually by regional service centers, education service centers, so we would be part of Region 6 that is home-based out of Huntsville. Yep. All right. So the Scott and White plan, our current HMO, we are also comparing to that same TASB Blue Essentials 1500 plan. And so that's a replica of what you saw in the second column, but just up next to the Scott and White plan because it is the most similar plan in terms of in-network coverage. It is a much broader network than what employees have seen under the Scott and White plan because it is Blue Cross Blue Shield. So again, very similar adjustments in terms of what folks might expect for their premiums and coinsurance and improvements on prescriptions. The fourth and final plan that we would be offering with TASB Health is most comparable to our current TRS Active Care Primary plan, which is also an in-network coverage plan. And so we're comparing that to another Blue Essentials plan that we're calling the 2500 in reference to the annual deductible. So you can see there we've got the same exact deductibles in this particular plan, just very similar, actually a little less on the out-of-pocket maxes, lower coinsurance, lower specialists, lower ER, lower generic drugs in all prescriptions, and then just slightly higher on urgent care. So that is the fourth and final plan that we are looking at here. And then again, you can see across the bottom our current enrollment in these comparable plans with the understanding that folks will make elections and we can anticipate that there would be some adjustments there based on what our employees choose for the next year. So with that, we did elect to leave TRS Active Care beginning in the 22-23 plan year and went through this process of RFP so that we could really best identify what options might exist out there for the employees of College Station ISD for next year. Using that established evaluation criteria, the TASB Benefits Cooperative earned the highest score and was recommended as best value by our evaluation committee. I think it's incredibly important to just reiterate that these plans offer comparable plans. So I say comparable because as you can see, they're not exactly the same. In many ways, they're actually a little better. And rates. So our rates for next year will be comparable to current rates with active care. So moving to TASB Health would really mitigate those anticipated cost increases that we fully believe would happen if we were to have continued with TRS Active Care. And those preliminary estimates using the similar plan selections would indicate that we may be looking at an overall annual savings as compared to our current plan year with comparable plan coverages for employees and their families. And so that is very good news because if we see those savings, we'll be able to pass those along to our employees. So what are our next steps? As Mr. Martindale mentioned at the beginning of our presentation, we are looking for board action at the regular meeting this evening, authorizing the superintendent to engage in those final negotiations and contracts with TASB Benefits Cooperative and the Texas Municipal League. And then we would make any final decisions surrounding employer contributions in the next several weeks so that we could begin that campaign of communication with our employees in May, which is significantly earlier than we've ever had the opportunity to see with TRS. And so that's wonderful because open enrollment could begin then and really occur throughout the summer to ensure that everyone has adequate time to learn about the plans, have their questions answered, and ensure that this enrollment goes as smoothly as possible so that when those new plans become effective on September 1, we are ready to roll with everyone having the information that they need and feeling good about their selections. All right. With that, what'd I miss, Amy? You covered it. We'd be happy to answer any questions that you may have.
All looks good. The comparison of the plans really do look, they're very comparable. As far as the rate side of it, though, the premium side, we just can't know exactly what those are yet. Is that?
So at this time, we are working through the process of establishing the employer contributions. And it's very hard to look at rates without knowing what those employer contributions are, because as an employee, what I'm contributing is going to vary depending on where we land with that information. And so once we finalize that, we'll have the rates available and published within several weeks.
But the expectation is that they will be
comparable, absolutely.
Wonderful. My only other thought is at the beginning when you mentioned the numbers of government employees that this TASB program is dealing with so far, I was kind of shocked at how small it was. You said 35,000. Mm-hmm. Just us alone is a big percentage increase, but you're talking about hundreds of school districts. How do we feel confident these folks are going to be able to handle this big increase?
So school districts is new for TASB Health. They've primarily worked with government entities, which obviously employ a much fewer number of employees than school districts. I don't know, Bob, do you?
Sure. Part of the strategy of this is, I think initially we looked at this as obviously an opt-out strategy, an exit strategy. Once the decision was made, we looked at our experience. We, as Gallagher, we do, and all we do is public sector, whether it's cities, counties, school districts, it's all our team does. We speak the lingo, and we're able to run modeling. And we saw early on this was a great potential for not only a one-year savings, but it was very important that getting out of TRS Active Care, we had to have not only a soft landing, but we had to have predictability on the out years. As was said earlier, the data coming out of TRS Active Care has been fairly wonky from a standpoint. It's a big macro type product with hundreds of thousands of lives. And the way that they were tracking this huge pool was not conducive to truly knowing what our own group was doing. There's a lot of missing information. So what was really important is, hey, it looked great on the first year, but we had to have something that was predictable for us in year 2 and 3 as we begin to kind of launch, where do we go from here? So with that said, when you're spreading risk over 35,000 members like TML's doing, that's a lot of expansion to spread our risk over. And then in year 2 and 3, Blue Cross, with all their power and wealth, was able to stand behind this risk with TML and establish rates for the second and third year. So, I think that what we're looking at primarily is to launch an opt-out strategy. But to begin almost immediately with Gallagher's help, we'll be showing all kinds of new reporting, modeling from day one, with the hope that if we can get 18 months to 2 years of really good data, and we will, from Blue Cross and Blue Shield, we'll be able to model you out to a point where maybe in year 2 or 3, it goes from an opt-out strategy to something that we can begin to build abundance in and hopefully launch ourselves in the future. So, I don't know whether this is a 2 or 3 year game plan. It's a 1 year deal for sure to opt out. But we have the safety net of knowing for 2 and 3, it's predictable and it's guaranteed. After that, the market's going to begin to open up to us with our data. And chances are we'll launch into something totally different. So I feel great that for the first 3 years, for sure, Blue Cross, with all of their wealth, will stand behind our risk. It's safe.
Well, that's good, the safety part of it too. And
is.
Will Blue Cross Blue Shield be the one that's processing claims for
Yes.
They're doing all the work. Okay, so we know they can do
Yes, the great thing about it is TML up till about a year
are
and a half
management
ago was
system.
with United Healthcare, and they had brought in all their own employee staff to basically represent by TML. When they decided to move to Blue Cross back in September of 20, Blue Cross's proposition to them is, let us run the health plan. And so this is actually a direct administration to Blue Cross and Blue Shield, so it's going to be almost like buying Blue Cross and Blue Shield in Texas.
That's really all I needed
Yeah.
to understand.
It was an
that Blue
important
Cross
part of
Blue
our
Shield is going to
discussion.
be managing
Yep.
and administrating the plan.
Yes.
Perfect. Thank you.
Anything else? Hey, we appreciate, guys from Gallagher, we appreciate y'all working with us on this and getting us through this and to this point, so thank you very much. All right, that will bring us to item 2, consideration and discussion regarding the work of the Academic Achievement and Class Rank Committee related to Board Policy EIC Local. Mr. Martindale.
Thank you, Mr. Horak and board members. We have Tiffany Parkerson, our Executive Director of Secondary Education, here with us this evening. Tiffany is going to kind of discuss the consensus points. You're familiar with this information. We're at the finish line. You also have some draft language that she will review with you shortly. There's no action on this item tonight, even in the regular meeting. This is for you to get your hands on things, have it for a little while. We do anticipate requesting some action at the May meeting, however. So with additional details, Ms. Parkerson.
Good evening, Mr. Horak, Mr. Martindale, and the board. This is my 9th update regarding the work of the Academic Achievement and Class Rank Committee. And tonight I'll give a brief overview of the process the committee went through, as well as a summary of our consensus and followed up by a clip of the draft language. And then there are a couple of points where the policy consultant with TASB has asked that we make some additions to our current policy that don't change the intent of it, but that she thought that was necessary, that I will share with you, and then we'll talk a little bit about the timeline. So as far as an overview of our process, when the committee was chartered, our purpose was to examine the existing policy and to determine whether any changes needed to be recommended. And the committee has determined that they would like to recommend some changes, and that these changes would be implemented for an incoming freshman class and would not impact anyone who is currently in high school. The committee, just as far as an overview of our activities, we reviewed the policy in depth. We looked closely at our current Tier 1 weighted course offerings in all content areas, examined the policies of 20 comparison districts, and then spent the second half of our time really reaching consensus on recommendations to bring forward to you all. So just a reminder that when we went through this process, we started in what is the middle of the policy, went back to the beginning, and then rounded it out with the third, if you will. In our existing policy, there is differentiation between the comprehensive high schools and College View high schools. In our recommended policy, all 3 high schools would be covered in the same policy. I wanted to point out that as well. So as far as our work, we really spent a lot of time during the first semester building background and understanding of GPA and the role GPA has in our students' lives and how they're impacted by it, and the nuances of transcripts and calculation and college admissions and so forth. And then you can see that really throughout the course of this spring, we've spent a lot of time honing in on each of the 4 different decision point areas and coming to consensus through that process, with our last meeting being on April 4th and 5th, and committee members could choose which of those meetings that they attended. So just a couple of reminders before we really delve into the wording. The purpose of GPA is to measure academic achievement. Once again, our policy title is Academic Achievement and Class Rank. So through this policy, we illustrate both the level of rigor or difficulty of courses through the weights and unweighted courses. And the purpose of GPA is also to contextualize that individual student performance by comparing them to others within that same graduating cohort of students. Once again, the primary uses are for college admissions. In Texas, we do have the top 10% automatic admission laws that this really has a great impact on whether our students are eligible for that automatic admission. Of course, scholarships, GPAs are very important in scholarship applications. And then for us here locally, we use these to determine our students who are recognized at graduation for those academic honors. So throughout this work, we've been rooted in the strategic design process that CSISD went through last spring, really staying rooted in our guiding principles that stem from the vision statement and the work of the strategic design group. I've shown this several times, but I think it really illustrates how the committee wrestled with the different topics and identifying areas of focus, and that as we worked through, we had 11 meetings. We only did this 8 times through the process. After our last meeting, the committee was still confident in the work that we're bringing forward to you and feeling really positive about it. The survey also had an opportunity for open-ended sharing, and so I wanted to share a little bit of that feedback too to contextualize the changes. A teacher noted that these changes would allow our students more opportunities to choose their passions without worrying about their classes that will increase their GPA, and that is talking about the portion that limits the number of courses that would be included. An administrator noted that the changes will encourage students to take advantage of the breadth of educational opportunities available here in CSISD, while also ensuring that greater equity within the overall school experience. And I'll end with a student that these changes will take the stress off of students and excuse those slip-ups. If we're taking the highest of those semesters, they have an opportunity to make some mistakes and take some academic risks, and that not be included in their GPAs. So as far as our summary of consensus, we'll work our way through, once again, in the right order. So if you are interested in following along in the red line copy I've provided, if you go to page 6, you will be at the point where we have the new language in the document. It's the first page that is entirely red. Okay. And perhaps I sent you to page 6 too early because the first section, consistent application for graduating class, is on page 1. It is not changing in any way. It's just indicating that the policy applies to an entire cohort of students when they graduate. The committee had reached consensus before our last board update about implementing changes with the class of 2027, our current 7th grade group. We had an opportunity to revisit that decision point at our last meeting and really discuss that. And I'll quote one of our administrators, a campus principal on the committee, and saying that we're saying that this is what is best for kids. We want to implement this as quickly as we possibly can. And they felt confident in implementing with this current group of 7th graders, and I'll close by sharing our timeline on what that would look like. Okay. So in the area of calculation, the committee has expressed a desire to include both unweighted and weighted GPAs on student transcripts. Just a reminder that we were able to do that cumulative unweighted GPA without including it in the policy, so we would do that in practice. And that really this policy focuses on the weighted GPA that's used for that class rank. And that these courses would include all eligible courses regardless of when taken. And so students who are taking high school credit courses in middle school, for example, those would go ahead and start accruing toward that GPA. Okay. Once again, the grades in the following categories would be included. I left these as a slide so that you would be able to see that, because when you look at the wording of the policy, it doesn't list out the inclusions. It only calls out a couple of very specific exclusions. So I just wanted to remind you that summer school grades would be included. That is in our current policy. Courses for which credit is earned through examination with or without prior instruction, and correspondence courses would be new additions to course inclusions. That would be a change in our policy. And then we would also include those distance learning online courses, especially through the Texas virtual learning opportunities, those things like that. The alternative means like correspondence and CBEs. If you can get your course credit for it, then it's eligible to be in your GPA, ultimately is what this slide means. Okay. So then when we look at the draft language, I've included on the slide the non-red inked version, because I think it's easier to read a little bit. We would include in the student's GPA or class rank GPA, up to 8 semesters each of English, math, science, and social studies, the 4 core areas, up to 2 semesters of languages other than English, and then eligible substitutions for any of those courses noted in those categories. And then there's a notation of all other eligible courses as well. This piece is incredibly important too. If a student completes more than the number of semesters listed above in items 1 and 2, then the class rank calculation shall use the eligible semester grades within each category with the highest converted grade point value. So we're looking at each semester of a course, not the full course year by year. If a student, for example, has 10 semesters of math, then the highest 8 semesters would be utilized in that class rank GPA. It does. That was what the student was alluding to, is that opportunity. Yes, ma'am.
Or if a student wanted to, say, test out of a science course so that they could take more of the advanced science courses, if that one that they tested out of was not as, okay.
Absolutely.
Yes.
Yes. So just to, I think, say what you were thinking through aloud. If we have a student who is taking a credit by exam because they do want to make sure that they're able to get to an upper level science, while that would be included in their cumulative GPA and their ranked GPA, they would have the opportunity to get to that advanced level or AP level course with
Okay.
the weight.
Okay.
All right, and the next section is the weighted grading system. Our current system has 2 tiers, and the committee consensus is to recommend that we move from a 2-tiered system to a 3-tiered system. Tier 1 would be advanced placement courses, Tier 2, advanced and academic dual credit, and Tier 3, all other courses. So this is illustrated here in the draft language.
Let me go back. I
Yes.
missed the piece where it says schools outside of the United States. And I just wonder, and maybe a small population, but with the international population we have in town, and then with I'd imagine DoD schools, are DoD schools accredited?
They are accredited, and we are able to accept their credit.
And then with the foreign students that are coming in, if it was their senior year and their parents are a professor at A&M,
Yes.
Okay.
Most, actually, I don't want to oversell. Many of the schools that students are transferring from, especially in an international environment, they may be able to accept it if they're accredited, especially if it is a DoD school, which you gave that example of. I will say that our counselors do a lot of legwork in figuring out what they are able to help kids with and give them credit for.
Actually, can I follow up on that real quickly, Tiffany, with a question? When you did say that basically anything that counts as credit would be included, except, and this is just, I don't even know, I'm assuming there's some homeschool folks who transfer in that things count as credit, but those are excluded.
But, well, and so within the previous part of that sentence, I think is important to look at with homeschool, because if it's non-accredited homeschool, then we wouldn't take it. I think there are some specific programs that are accredited where we are able to accept their credit.
The accredited part again. Okay. Thanks.
Very nitpicky question, but I know y'all probably all had it in your head when you were going through this process, but when you say up to 8 semesters, could that be read as including less than 8 semesters?
So based on the conversation with the policy consultant, there are a few exceptions where we will have a student who might move in or have some extenuating circumstance, and we would still issue a class rank for that student. In accordance with state law, we would need to be able to do that. And so the up to is part of her advisement.
So even if they only had 6 hours of included, or 6 semesters of included, they would still get a class rank?
They would have to have a class rank, but there are some exclusions when we look at local graduation honors, with some stipulations of the amount of time they need to be in CSISD that would prevent someone from being at a certain, like the highest ranking graduate certificate recipient or something like that. Okay. All right. So in this section, once again, we're looking at the verbiage that describes the courses of each tier. And then this also includes the conversion chart. This one is not nearly as pretty as the one I've been showing you up until this point with all the colors, but it does represent the same conversions based on the 3 tiers of the course offerings. And then also the transferred grades verbiage is added here, which basically says that if we have the equivalent course offering, we'd issue the advanced credit or the AP credit and so forth within that. Okay. All right, as far as looking at our local graduation honors section, the committee chose to recommend to continue our current practice of utilizing GPA cut points to determine these academic honors for graduation. The committee felt that this allows students to compete against themselves and the scores that they're making and meeting a threshold to get those academic honors and that recognition through graduation, rather than using percentage points or so forth that some school districts do, or limiting to a certain number of graduates. I'd also like to remind you that we did that sample set, and one of the committee's goals was to make our summa cum laude set of graduates, which at this time is our largest percentage of graduates, between 18 and 20% of a class, to no longer be our largest graduate and set of graduates. In the 3-tiered system, it looks like will naturally cause more of our students to graduate magna than summa based on the 3 tiers of weighting. And so you can see how this is illustrated in the policy language. There, I think, is very little change to the first 2 paragraphs. Really, it's the calling out and change in formatting from what we do right now to having the bullets on the summa cum laude, the magna cum laude, and the cum laude graduates, as well as the ranges that are listed there. All right, and then the additional language that has been recommended by our policy consultant is to include the language surrounding the highest ranking graduate. We are required, based on a state law, to issue a certificate for the highest ranking graduate. There are some perks if they choose to go to an in-state university as far as tuition and scholarships. And then our current policy does not include any information on what we do if there is a tie with that highest ranking graduate. And so she also suggested that we add that information to our new policy as well. And I'll show you the impact of these 2 areas in our current policy. All right.
I don't know, maybe you haven't gotten here yet, because I remember it from transmittal. Are you going to talk about the valedictorian and salutatorian? The committee decided not.
I can go back. It's included in this section with the local graduation honors. And so based on the follow-up with the committee discussion, there was not consensus that showed a desire to change anything about our current practice. So this language is what is included in our current policy.
Okay, but they're still recognized on their transcript as being number 1, number 2.
Absolutely.
So on and so forth.
Yes.
Just out of curiosity, why does our district not do that?
So I think that it comes down to
I didn't hear what you said, Blaine.
I think it speaks well of the academic competitiveness of our students that about 40% of our graduating classes right now are honor graduates. And so in looking at our 20 comparison districts again and parsing through, there are 9 of them, about half of them that only have in their policy a recognition of those top 2 students, so the valedictorian and salutatorian, and don't really outline any other graduation honors. And so I think that it goes back to, because of the highly competitive nature and a desire to celebrate the most students we can who have that academic success, that's why they chose to move forward in it. You know, this is one of those areas that we had lots of really good discussion about.
So is it one or the other, but not both?
There are some districts that do both as well.
Okay.
When I went back through, just like all of the other parts of the policy are as unique and local, this is another aspect of that as well. Yes.
Okay.
Tiffany, on the concept of comparing GPA, so if a College Station ISD student got like a 3.85 and they're magna cum laude, I remember very early on, y'all had like a comparison that if they were in like Caldwell ISD, would they still get a 3.85, and would that still be magna or summa cum laude? Did y'all do that?
So all of that is a little bit different based on every individual school district and whether they choose to do different levels of honor graduates or not. And so any kind of a transfer like that, if they went to Caldwell ISD, they would then have to be
Well, I'm thinking from the
recalculated.
more when people are applying it, is our GPA very similar to other people? So if a 3.85 in CSISD, would that still be a 3.85 in Travis or in a smaller school district? Is there any kind of comparative analysis for that?
Not necessarily an apples to apples comparison, but I think when we're looking at what we learned from the admissions counselor at A&M, for example, whenever they are applying, of course, they look at the top 10% or whatever percentage they have room to be able to take at this point, automatically admissions. From that point on, everyone else is evaluated holistically, and the larger university systems have them input their grades and recalculate their GPA so they can compare a student from College Station ISD to another school district in that way through that lens. All right. Okay, and then in addition, I shared that the policy consultant recommended we do some other updates to our current policy, and that would include that language around the highest ranking graduate and the breaking of ties for the highest ranking graduate. And then she just did a little bit of formatting to make it clearer where the cut points are here. In our current policy, this is all one big paragraph, and frankly, it's a little hard to find the information that you need from it. So she recommended this change in formatting and the additional language here to meet our legal requirements. Okay. So as far as our implementation timeline, we would like to come forward with to you once again in May at the May board meeting and ask for potential board action with these changes. Should that be approved, then on May 18th, we'll have our communication set and ready to go, which would begin with an email to all of our families of all students who are in the class of 2027, this group of seventh graders, explaining in the most layman's terms what this policy means and how it would impact them. I would foresee additional layers of communication coming in through advisory classes and counselors and so forth to make sure the kids really understand what this means. And then we do have students who have already signed up for credit by exams who may have chosen to take that without thinking that it would have an impact on the GPA. And so we would also send a separate communication specifically to those families about the impact of the policy and changes on CBEs, and we would give them an opportunity to go ahead should they choose to take the test, get their scores back, and then determine whether or not they would like to accept the credit in the grade at that point for this group only due to the late notice. So it's not one or the other. If they choose the credit, they choose the grade to be included as well. But Ms. Nolan, as you shared, we would also share with them that primarily they're opening up time in their schedules and they will on the back end have more credits to be able to contribute toward that class rank GPA. We also, in this communication to families, would let them know that should any of these policy changes impact their course requests for their 8th grade year, if they are signed up for some high school courses that they might want to rethink, we're giving them a few weeks to get with their counselors to change those course requests, and that will allow us plenty of time to make any adjustments needed in the master schedule related to that as well. Then in the fall, we would need to go back through and revise our 23-24 course guide in alignment with the changes. And then we would also at the same time be working on adapting our computer systems for calculation and transcript changes so that all of these things are ready by the time this cohort gets to high school. So really that gives us a year on the backside of things to get things ready for them as they enter high school. They, of course, would then officially enter high school in August of 2023. And then in May 27, we would celebrate the graduation of our first cohort of graduates under this new policy. And with that, I'd be happy to answer any questions that you may have. Okay.
I have a few comments.
Okay.
I have to ask a lot of questions over the last, how many months have we been doing this, Tiffany?
Almost 9.
Almost 9. That's kind of apropos, by the way. It's not feel like we're delivering a new policy to here. It's taken 9 months to get there, but it's been good. And it has been so important and meaningful. And I just, again, I want to do it every month, just cannot thank the folks who have participated in this enough for the time and effort that they've put into it. Thank them for putting up with me poking and prodding on this, because, I mean, this is big. I really think I'm not sure we all even realize how big the changes are, but they're significant, and I think they're meaningful as well. I think it's going to be a lot of really good things for our district. That's what I'm hoping. I didn't win on every vote, but I don't think anybody in that committee can say that they didn't have a chance to ask questions and get the answers. They didn't have a chance to speak their mind about how they felt on an issue. So I appreciate you allowing that to happen. And again, for all of us, for forming the committee and letting this work proceed. So I'm excited to see how it unfolds. I'm excited. That's about consensus. I know what the word means, so I'm.
And again, there's no particular action this evening. Want to give it to you a month in advance to have. If you have particular questions between now and then, please make sure and reach out to Ms. Parkerson or myself. So we'll probably be looking for action at the May board meeting. So there's time to process. It's lots of information. Thank you, Ms. Parkerson. I echo what Ms. McAdams said. Thank you to the group. It was easy to leave those meetings mentally exhausted. So thank you for your work and leading the effort.
Thank you. And I'd intended to thank the committee at the very beginning because we do have a few of our members in the audience who came tonight. So thank you for participating and being part of the committee and coming tonight to hear the overview.
All right. Anything else? Thank you, Ms. Parkerson. That brings us to item 3, consideration and discussion regarding the work of the School Health Advisory Council. Mr. Martindale.
Thank you, Mr. Horak and board members. Here tonight in workshop with all things SHAC is Mr. Jeff Mann, our Director of Instruction and Leadership Development. Mr. Mann.
All right, thank you, Mr. Martindale. Mr. Horak, trustees, good to be here this evening. Typically with the School Health Advisory Council, you just received the board report in the regular board meeting, but there were lots of changes in this past legislative session, and so we felt it was important to kind of walk through what those were and let you guys know what we've done as a district to make sure we're meeting the requirements. So that's the focus of this presentation right now. So I'm going to give a brief overview of the courses in CSISD and the changes that we're making that'll take effect next year. We'll talk briefly about the TEACS changes, legislative changes, the instructional materials adoption, and then EHAA legal and human sexuality instruction CSISD action that you guys will have to take next month. So with our courses and changes that we have taking place next year, you can see what we have listed up here for elementary. It's very familiar. In fact, these haven't changed from this year into next year. We have our camp rotation where they're still going to receive 150 minutes a week of PE, and then our health is going to be addressed through our coordinated school health efforts, where our nurses and counselors and teachers all work together through the curriculum to provide the lessons to the students. And the same will go for intermediate. They have full day PE, and then the coordinated school health effort for those guys. So it's the same as what we've had in place. Where there is a change next year is going to be in middle school. And so PE will have students enrolled in either athletics or in a full year PE, or sorry, a 1 semester PE class. So you can see it spelled out here. They're either in athletics or they take PE in 7th grade for a semester and PE in 8th grade for a semester. Currently, right now, they sign up for either one and they get their full credit. They can pick wherever they are. But this is a change that we are making to help benefit the kids and make sure they're getting physical activity through both years or if they're in athletics. And then with regards to health, all students are going to take health in 7th grade. And this is looking at the continuum of courses that we have in CSISD because we're also making some other elective course changes. And we want to make sure that all of our kids are able to take the courses that they need while they're in the middle school piece. TEA requires for us to offer health somewhere in 6th, 7th, or 8th grade. And for us in our flow of courses, it works best for them to be able to take that in 7th grade. And so all students will take that half credit at a 1-semester course during that year. And if they take it in summer school, it counts as well. And it'll be the same course curriculum that they're taking in summer school. In high school, they're required to have 1 PE credit for graduation. And you can see here the variety of course offerings that are listed. And you can also see the courses that are non-physical education courses that do count for that physical education credit. So there's lots of choice for students to be able to gain that credit in the high school setting. And health is offered in the high school, but it is not required for graduation by the state. And so locally, we do not require that as a graduation requirement. We have about 30 kids at each school that take health each year. And so it's not a high demand course, but it is there for any student that wants to sign up and take it. So moving on to the health and PE TEKS changes, there are many, many changes. I'm not going to click on those links, but they are linked into the agenda. If anybody wants to click on those and look, there's about 50 pages with PE and about 35 with health. So there's lots of adjustments in there. And these all take effect in the coming school year. So within August 2022, we have been working hard to make sure that we have all those accounted for in our curriculum. And then we have the legislative changes that have come in this year. And so I'm going to walk through these and just make sure that we have some understanding around all of them and talk with you about what we're doing to make sure that we have met these requirements. So we have, it is not officially 100% the Open Meetings Act, but there are many components of the Open Meetings Act that we have to make sure that we're meeting, and so you can see those listed here. We have to post the agendas with dates and hour and place and the subject of what we're going to talk about at least 3 days in advance. We have to post audio recordings of the meetings after the meetings have taken place. And so that's been an adjustment for our members to remember to speak into microphones so that they can be recorded and saying who they are. And then we have to take minutes with the subject and the content of the deliberations, and then any votes or orders that are made and any decisions have to be marked in the minutes as well. And all those have to be posted onto the district website. And we do all of those currently. We have a SHAC district website where we post that information. With regard to parental notification for human sexuality instruction, so before the school year, the district is going to be required to provide written notification to all parents about the board's decision regarding human sexuality instruction. And so that's something that's sent out, and it cannot be sent out with anything in addition, and that's what's on this next slide. With the notification, we have to list what does state law say, and all of this is being driven by state law. And so that's in the notification. We have to provide a detailed description of the content that we're going to be teaching. So like a mini scope and sequence of this is what we teach as a part of human sexuality instruction. And this is where it is. And that we have to provide notice to parents that they can review materials that we have, or they can purchase those that we have. And tonight, here in a few minutes, I'll talk more about what that looks like in the instructional materials adoption piece. And they have to be notified that parents can remove their child from any of these instructional topics that they wish. They have that choice, and we'll get into that here in a couple minutes. And then if the parent is not satisfied with what we're doing, then they have the ability to use the grievance process locally, or if they want to use the TEA complaint process. So all of these items, we have to make sure that we provide notice to parents if we are teaching the human sexuality instruction components. And so there is the opt-in process, and the opt-in process is exactly what it sounds. It is an opt-in. In prior years, it's been an opt-out. And so this is a legal change, and we are required to obtain consent from parents, specifically whenever we're going to be covering topics related to human sexuality instruction. And we have to send this home at least 2 weeks in advance. So we have to send home notice at the start of the year. And then whenever we are coming up to a topic that we're going to cover that falls under human sexuality instruction, we then have to send home a notice, and it has to be signed and returned, or we're not going to be able to teach that child. We will have a different location for the students that their parents didn't opt them into while the lessons are being delivered. It's only for the kids whose parents give consent. It is an active consent. It's not an opt-out.
Can I clarify a question?
absolutely.
Is that including the pieces that are in the TEKS? That includes what's, even though the state has decided this is in the TEKS. Okay, just
Yeah,
clarify.
any of the TEKS that have that label of human sexuality instruction on them, that's what we'll have to provide, the opt-in piece. And so there's several of those TEKS that have those listed. And so that's where at the beginning of the year, whenever we provide that general outline, it'll let parents know, like, during this phase, these weeks, these are the things we're teaching. And then we'll have to provide that notice as we get closer to those.
So the parents could opt in for their student for week 1 and 2.
Yep.
Opt out of 3 and then
Yep.
back in. Okay.
Absolutely.
And there's no credit punishment.
No.
Okay.
No, not at all. We would just have an alternative assignment for them to do that's not related to human sexuality instruction, but it's related to health. Yeah, they would have something else that they would complete.
So just to further expand on that, so parents can choose which portions of the human sexuality content they want their kids to be part of, or is it all or none?
Nope,
They
it's
can
which
choose?
piece, which
Okay.
portion. And that's the intent of the law, is to give parent control and parent choice.
Okay.
Yeah.
I was just going to say, somebody throughout Shack shared an actual, like an example of a letter that went out and, had little check boxes for all the different topics. And yeah, and you choose the ones.
Yes.
Okay, so just one letter will go out, not,
At the beginning, but whenever we have to meet that 14-day prior to that instruction. It's like
Okay.
we'll have,
so
because,
we have to remind people
yes.
or ask again?
Depending upon when the topics fall in the scope and sequences. Yes, like if they're consecutive in the lessons, like Monday, Tuesday, Wednesday, Thursday, well, we wouldn't do one for each one. But if it's like in week 3 and then in week 7, yes, because that would be a larger gap that we'd have to look at. And especially if they're dramatically different topics, because human sexuality instruction is a variety of possible topics that could be covered. And so that's what we'd spell out and give parents that information.
Okay.
Okay, other questions regarding opt-in? Okay. Instructional materials access. So we are required by law if we are using items that are considered in the public domain, then we have to post those on our district website. Okay. We are not planning on doing that. We are planning on using items that we purchase through a publisher, and so those will be considered copyrighted materials. And so those have to be made available for parents to either come in during regular business hours and either view a copy here at the central office or view a copy at the school. Or they also have to have the ability to purchase that if they want to. And so publishers, by law, parents have to be able to have that option to go and buy it for them, and it can't be at a more expensive rate than what the districts pay for that. And so we will communicate that out to parents as a part of that notification of, if you would like to view, this is how you view. If you'd like to purchase, this is how you purchase. And then that way we have that.
But a list of those materials will always be available. So if a parent's like, oh, that sounds okay, and then they hear something, they want to check it.
Oh, yeah, it's not a one-time
always open.
thing, right? Yeah, and any time. I mean, we have it happen in all kinds of content areas where parents want to come and look at what we're teaching. They come up to the school and they can view the materials.
All
That's
easily
not
accessible. We're
uncommon.
not trying to hide anything.
Yeah, absolutely not. Right. So with the adoption of the instructional materials, so there's specific policy for adoption that has to include the shack. And so we've done that. Actually, what I'm going to do with this section, I forgot. So these bullets, I'm going to go through each one and kind of update you to let you know with what we've done with each one of these. So I don't read all these to you and then go back through them again. So with the first one, so we have specific policy for adoption of human sexuality instruction materials that includes the shack. And so if you recall, in January, you guys authorized the shack to be a part of this process. And that's a legal change that had to be put into place. And so you guys did that as a board. And then we were able to do what we needed to do with the shack. We must hold at least 2 public meetings for the instructional materials adoption before we adopt any materials. And so we held, the shack had the review of those on February 28th, which is also a public meeting, but then we had 2 specific public meetings on March 7th, and we had attendees come to the second meeting. We didn't have any attendees come to the noon meeting, but we had a couple of people come to the second meeting. The shack recommendation must comply with the instructional content requirements in law, suitable for grade levels of instruction and reviewed by academic experts. And so we are in legal requirement, We have the opt-in instruction, and that's a big component of it. It has to be suitable for the grade level. The materials that we are going to be looking at adopting, recommending for adoption next month are for middle school. So they're suitable for the kids that are going to be receiving it. And then they were created by the curriculum companies. This isn't something that we're creating and putting together ourselves. This is why we are going with copyrighted materials from publishers. And these were recommended as a list from the State Board of Education as a part of the proclamation process. And so that's who we've looked at their materials to evaluate what we're going to adopt. The SHAC presents recommendations to the board at a public meeting. That's what's going to happen this evening, as I will include the recommendations of the SHAC. And then after you guys receive the recommendation, your responsibility according to law is to make sure that it meets the standards, and then you take action as a board in a public meeting by a vote. And so that's why we're asking for you to do that in May. You receive all the information tonight, and then you'll have time and not have to rush and make your vote and your decision. Okay? So Proclamation 2022, this is the health and PE instructional materials adoption. So this is the timeline that we've utilized. You guys authorized the SHAC in January. So then in February, we brought the teachers in and had them look over, make some recommendations. The SHAC reviewed, we had the public meetings. And then at the end of March, in our fourth SHAC meeting, they came together with what a recommendation would be for you guys. And they asked us what we recommend, and whenever we make our recommendation next month, this is where we're leaning toward the materials that we want to adopt and for the grade levels. And in the SHAC meeting at the end of March, they were in agreement. And this is all based on the feedback from teachers and from SHAC and from the members of the public that looked at it. And so in our recommendation next month, this is what we are anticipating bringing forward to you guys. And then finally, there's the human sexuality instruction in CSISD, EHAA legal that we need to go through. This is where the SHAC recommendation is going to come into play tonight. So currently, this is what our legal policy says. All right, EHAA legal was updated in November 2021, and you can read through, the definitions at the top, but it specifically says the board shall determine the specific content of the district's instruction in human sexuality. And so the board is responsible for selecting instruction related to these topics, and it's human sexuality, sexually transmitted disease, human immunodeficiency virus, or acquired immune deficiency syndrome with the advice of the SHAC. And so the instruction must include these 5 components. And so it has to present abstinence as the preferred choice of behavior for unmarried persons of school age, devote more attention to abstinence than any other behavior, emphasize that abstinence is the only method that is 100% effective in preventing pregnancy, sexually transmitted diseases, infections with HIV or AIDS, and the emotional trauma associated with adolescent sexual activity. Number 4, direct adolescents to a standard of behavior in which abstinence before marriage is the most effective way to prevent pregnancy, sexually transmitted diseases, and infection with HIV or AIDS. And then number 5, teaching contraception and condom use in terms of human reality rates. Make sure I read it. Instead of theoretical laboratory rates of instruction on contraception and condoms is included in the curriculum. So currently, we do not have curriculum that includes anything related to condoms or contraception use. Therefore, we do not teach it. Does that make sense? We cover 1 through 4 currently in the work that we do, but we do not have a curriculum that includes the items listed in number 5. And because we don't have that, we do not go into that instruction. The SHAC recommendation this evening is they want the adoption of materials that includes the discussion of condoms and contraception, which would then have us teaching that in our classes in health. But this would be a opt-in, 100% opt-in. But that's going to be part of the recommendation this evening.
I have a question, and maybe going back a little bit, but
Yep.
health, this is a state legislator-directed policy.
Yes.
And health is required in 7th grade.
Health is required in 6th, 7th, or 8th grade.
If a family decides, 7th grade is not appropriate for my child for whatever reason, or I'm better suited as a parent to teach this topic to my child, is that student punished academically? Like, do they lose that credit? How do they get credit for that?
So there's two different things that I heard you ask. So one, if they don't want to take health in 7th grade, they could use the summer school option and take it prior to 8th grade, or I guess post 8th grade before high school, but they'd have to take it in 6th, 7th, or 8th.
Okay.
The other piece that you said, if they don't want to be a part of this instruction, they don't opt into it, there's no consequence for that. And that's the legal opt-in law that gives the parents that choice.
And then maybe beyond this memo, but with the update to the education, to this education, is there a discussion of consent or any kind of values-based discussions related to the relationship aspect of sexual activity discussed in this course?
What we teach is what's listed in the TEKS, and it's all listed, it follows these 5 items right here. And they're very specific in the TEKS. Yeah.
So I'm confused. I mean, this is legal. This is a legal policy, and it says number 5 is on there about teaching contraception and condom use in terms of human,
Right.
So we have to approve. I mean, if it's legal, don't we have to approve
No,
curriculum
that's
on
the
that?
word if. If
If.
instruction is included in the curriculum. So if we adopt instructional
okay.
materials that do not include that, and so there are, with these materials, they have the opt-in with all,
Okay.
I believe, 18 chapters or 19 chapters, and they have the non-opt-in, and it has 16 chapters.
Okay.
And so that's the difference. That's the decision point that the
Okay.
board will have to look at and decide.
Okay. Thank you. I understand.
Yeah, it's all about what we have in our materials. Yeah, this took us a few times to really get some good understanding around it. It's very confusing.
So we're going through all this because it's required
Yep.
that SHAC have this conversation and make a particular recommendation by EHAA legal, not local, legal.
Yes.
That was recently updated. And ultimately, SHAC will make a recommendation of which administration will support or not at the May board meeting for the board to consider. With that, whatever is included, the parents have the opt-in component. And I think that's what's vital to understand here is all this is providing parents the choice. So it's not you're opted in unless you say, it's you're opted out unless you say.
Correct.
Which means you have to be intentional as a parent to ask to be included. Okay?
That's correct.
Does that make sense? Correct, Mr. Mann?
That's
Okay.
correct.
All right.
Yep. And so the next steps in this, there's no action tonight. It's just to receive the report and understanding, and then review information. And I will put information in transmittal leading up to next month. And then in May, you guys as a board will then have to record a vote to determine which instructional materials that we are going to adopt, either the with or without. And then that'll be the end of this process. And then we will begin on the curriculum side of things. Okay, questions, comments?
Regarding health, any changes to off-campus PE for junior high or middle school or high school?
No, that's all still in place. Okay.
I was just going to say that there just won't be counted in the GPA anymore from the other committee. That was but no PEs and athletics. Well, great.
All right.
Thank you, Jeff.
Yep.
That brings us to item 4, consideration and discussion related to the 2022-23 budget development process. Mr. Martindale.
Well, I see Ms. Strauss there, excited that you're.
I think she has some good news for us, maybe.
And I'm sorry, my eyes are really bad, so I may have
I'd
to
like
go
to
over
point
there.
out to the board that it's still April of 2022. Do not get excited about these numbers. I did it for you, Mr. Martindale.
Thank you. Ms. Strauss, our Chief Financial Officer, is here to present. 6:10, we're going to be cognizant of time. We probably need to make sure wherever we are to be finished up at 6:50. So just know that we'll be watching time to make sure we can transition to the regular board meeting. We can handle 5 and 6 on the agenda, I think, in quick order. So With that being said, no pressure, Ms. Strauss, it's up to you.
So good evening. Thank you very much for the opportunity to share some preliminary budget information. So just tonight, we will just briefly go over goals and objectives again, just as a reminder. Look at the current year, 21-22. Look again at 22-23 with some updated information I've received since the last month when we visited with you. Just start some preliminary conversations on compensation, and then the timeline and historical data. Historical data we will not go through. That's all was shared with you last time. I just put it there for reference so you can easily look at that if you'd like to. So goals and objectives, we're not going to go over these. I did last time. Just as a reminder, there's 2 on here that are new from last year. The third bullet, utilize data that's available when making budgetary recommendations that are in the best interest of the district. And the last bullet is new from last year, but was discussed last time, is to begin to reduce the use of ESSER funds in support of the general fund. So those 2 are new items, but we did go over them last month as well. So first, to talk about 21-22, because that is our base year that we'll always use to build off of. Last month, I talked to you about what's called the Target Percentage Attendance Rate, TPAR. TEA implemented this for school districts' benefit for period 1 last time I talked to you. It's because of the pandemic and the poor attendance rates for districts across the state. And we are funded based on average daily attendance. So they put in some a target percentage rate that would help districts out for period 1. Then come period 4, attendance rates were actually worse in period 4 than they were period 1. So I communicated to you, I anticipated a change coming, but we didn't have it. As of the last meeting, I think the day after, they came out with something, and now they have refined it and given that. So now the amended target percentage attendance rate applies to periods 1 through 4. They incorporated all 4 of those periods. Period 5 and 6 will be on our own. But that target rate is going to be based on the attendance rate CSISD and all school districts experienced in the first 4 periods of the 19-20 school year, the last time we had a normal fall. Okay? And they'll look at the better of those 2 rates, either your actual or this rate back in 1920. So when I look at periods 1 through 4 for College Station ISD, our attendance rate was 93.6% on average for that time period. And in 1920, that was 96.39. So we are going to benefit from this particular hold harmless provision that the state TEA put in place. So to put that into perspective, that chart shows you period 1 through 4, and that estimated increase is the additional ADA we will get to claim for revenue purposes because of that target percentage rate. So I estimated period 5 and 6 just based on where I think we might be. So looking at the whole year, I think we will be better about 250 to 260 average daily attendance to where we would have been if we were all on our own. But the good news is, I don't always get to share good news in budget, right? Is that you look at the very last column, and that's the budget you adopted. So we adopted revenue based on an average daily attendance of 13,160. I believe we will be better than that by over 100 average daily attendance. So I'll show you the impact of that. So I at least get to share you a little bit of good news tonight.
She got it out of the way early.
So now we look at our revenue. Our adopted revenue, less recapture, is $124.7 million in the general fund. Utilizing this attendance rate and that updated average daily attendance, $125.8 million. So overall, about a $1.1 million betterment from what the budget that was adopted on the revenue less recapture side. Now, I will reiterate, like I did last time, this revenue, and in a minute when we look at expenditures, does not include what we would report as extraordinary items. Those are the insurance proceeds from the winter storm and the hailstorm that we incurred, nor the expenditures, okay? So then comparing that to appropriations, that revenue to appropriations, adopted appropriations exceeding revenue of 2.9 million. I believe when we look at this at the end of the year, I'm projecting out to be a negative 1.9 million. So again, an improvement of about $1 million. I have incorporated some additional expenditures for fuel and a few other things that, because of inflation that we're experiencing, that I talked to you guys about. I do want to start giving you a glimpse of what I think those extraordinary items that we will have to report are going to be. So at this point, I'm estimating insurance proceeds to be just shy of about $2.7 million that we will recognize, and expenditures for hail and the roof and hail damage and that sort of a little over $4 million. So that's a negative almost $1.4 million. A lot of that is due to two different things: our deductible, as well as what they call unrecoverable depreciation. A number of our roofs that were damaged were old. And so because of their age, we do have some depreciation on those that is not recoverable. I am hoping that we will recognize a little bit of additional revenue. We've applied for some financial assistance, federal assistance related to Winter Storm Uri, and that we might get some of our deductibles back on that. So I've applied for $100,000, so we'll see if we get that. It's going to be my recommendation when we get to the end of the year is that we take this 1.4 million, or whatever it comes out to be, from our reserved fund balances for construction. This is extraordinary. It doesn't happen on a frequent basis. It's not a regular operating expenditure and construction and building related. So we'll bring that forth to you and let you consider that at a later time. So now moving forward to 22-23, I shared with you enrollment projections last time from our demographer. So we've seen some incredible growth in our student enrollment throughout the year this year. It's continued beyond what we call snapshot date, which was the last of October. So you can see the second to last line there, 22-23. That is what our demographer was estimating for us when he gave a report in December of our enrollment. So he was thinking for 22-23, this past fall, that we would have an enrollment of somewhere around 14,594. So we're going to get an updated report, but he went ahead and gave us some enrollment numbers because we were looking at budget. And recently now, because of our growth from fall till now, is looking at 14,689 for next year at this point. So you can see people are continuing to move into the area. Right now, as of today or yesterday, our enrollment was 14,320. So that's where we are right now. So we're continuing to grow. We also want to look at what they call the maximum compressed tax rate. So we talked about the fact that as property values grow, we are required, because of House Bill 3 in 2019, to compress our rate. And the state controls that. So they're going to have a state compression based on how the state overall grew. And then if we grow, our values grow better than that, then we have what they call local compression. Okay? So we know that values are increasing here and there is a lot of new construction. So kind of looking at that, feel like 7% at this point is probably a good percentage to use for budgeting purposes. So that's what I've based our projections on. and calculated what the tax compression would be if the school district landed at a 7% overall property value growth from last year to this year. So looking at that, holding the debt rate constant, because we did issue that new debt from the 2021 bond. The M&O tax rate is estimated to be 92.96 cents. That is down 2.25 pennies from its current 95.22 rate. Okay, that has both state compression and local compression. This does have the additional 5 enrichment pennies that you as a board have approved us to have. So that's factored in there. And when we go further, I've also gone ahead and factored in the additional homestead exemption that's on the ballots for May, from 25 to 40,000. That's all factored into here. So just as a reminder, this is also in the data at the back, but you can see since 2017 or 2018-19, the rate has declined overall. Some of that is House Bill 3, but we also had a decline in the debt rate. But we've had a decrease of over 14 cents, almost 15 cents in the past 6 years. So the assumptions, again, used, I said 7% with that tax rate on the maintenance and operations side of 92.96 cents. Using the enrollment that the demographer projects for us of 14,679, that is 3.5% above what our snapshot enrollment was this past fall. I use snapshot because that's the published enrollment, and that's what TEA will be looking at next year. So 3.5% enrollment growth and average daily attendance. So utilizing that data, and I think last time I had 2.7% enrollment growth, so I'm using 3.5 this time with the 7. You can see that estimated revenue less recapture is $128.2 million. That's up $3.5 million from the adopted budget this year. So a couple of things. First, you'll see that arrow on the fast growth allotment. I did not have that information last month when we visited. So that $686,000 is new revenue that I've put in. And then, of course, the property values and the increase in enrollment is all additional information bringing the revenue up by $3.5 million. Recapture, of course, also goes up. A lot of that is because of how the formula works. Increase state revenue, but also increase in recapture. Those are offsets. So if we were to apply this projected revenue to the same appropriations we have this year right now, what you adopted, with the exception of recapture, I'm going to make that correction. Revenues would exceed expenditures by $600,000. So we're finally in the positive in that particular area. But also to note is the ESSER fund supporting the general fund, I've also decreased by $700,000. So we're moving in the right direction there. But remember, that's no additional expenditures, but we do have some things that we know we're going to have to consider. So just as a reminder, when we start to talk about compensation, for every 1% increase that we do, that costs us a little over $1 million. We are looking at managing any additional FTEs and growth within reallocations within the district, using cardonics and those sorts of things, finding efficiencies. So we're not looking at, even though we have student growth, much in the way of total additions to staff. Our CTE program, I mentioned last time, has grown the last couple of years, and there is a spend requirement there, so I'm anticipating some additional expenses there. And then, of course, those uncontrollables, fuel, some software increases, property and casualty insurance in those appraisal districts. Those are some areas that we will be getting some dollar amounts in the near future on what we need to consider adding into the budget. So just some introductions to start conversations on compensation, and these will continue next month. But I just want to look at teacher salaries first and kind of explain this chart to you. So the very top box was 2021, our teacher salary schedule when we compared to our peer group. So we look at the median for our peer group and where College Station ISD was. If the percentile is in green, that means that we improved from the prior year, our position. If it's yellow, it's neutral. And if it's red, then our percentile went down. Okay, so that's compared to the prior year. So I put the middle one in there because last year when we were working on salaries for 2021, you can see we were hoping to improve on the 0 through 15. But of course, we're looking at College Station's 21-22 teacher salaries to our peer groups prior year because we didn't have them. So we always know that when we end up, it's going to change a little bit because they probably also gave raises. So 21-22 now, we have all of the peer groups data, the same peer group, so that we're comparing apples to apples. The same peer group looking at for 21-22 College Station ISD to that median, you can see we improved on the 0 year. We now have we're in the 93%. We were 92, so we're going to compare the top to the bottom. The middle was just hopeful. We remained neutral in the 5 to 10 year area, but we lost a little ground in the 15 and the 20. So that kind of gives us a base of how we need to look at teacher salaries as we're looking at compensation this year. That's why this is important.
Ms. Strauss,
Yes.
and not for discussion right now, but I'd be interested to see what the attrition, as far as our teachers coming to our district versus other district. Because there's been a lot of news about the teacher either retirement or moving. And I'd imagine some of that increase in salary is trying to either recruit or retain from other districts. I'd be interested to see what our numbers as far as employment versus our peers is.
As far as the attrition being.
How many people are leaving? Are people coming here from other school districts? Because my first glance is I think we're investing a lot in the CTE programs in professional development, where other people may just be trying to throw salary.
Right.
To try and retain people.
We can include some turnover data in our next budget update to take into consideration as we explore compensation.
Okay. So we are not, looking at what we're going to be doing for next year. This is just kind of a baseline to so that we know where we need to focus on our compensation. So in looking at this, we ask ourselves, so how can districts generate budget capacity? Not just College Station ISD, but this is true to districts across the state under our funding formula. The first thing everybody looks to is we need to reduce expenditures. And certainly that is a way to generate some capacity. So that's unique, it's every district, but it's not unique to us. But the graph there is College Station ISD. So what that says is 85% of our budget is in salary and benefits. And then you can see the percentages for contracted services, supplies, operating costs, and capital outlay. But I think it's interesting to note, look what's in contracted services, our next biggest area: utilities, appraisal district, school resource deputies, copier leases. These are fixed costs. And so, you take that out, there's not a whole lot left in contracted services to look to. Supplies and materials, our campus and department supplies, fuel cost, and then 6,400 property and casualty insurance, student travel, and then very small amount of capital outlay, which is a lot of where some of our maintenance things come from. So, in our budget, there's not a lot of room to generate capacity with budget reductions unless we hit that
I'd like to note on a previous, not a budgetary discussion, but our administrative staff on that payroll is very small compared to
It
a
is
district of our
very small.
size. And so I think it shows a lot that we're putting our money where the rubber meets the road with those teachers and the people that interact with the students on a daily basis. So I think it's a well-justified number, given our structure.
And then the other two ways districts across the state can generate some capacity is, of course, increased enrollment. We're fortunate to have that growth. Increased enrollment comes also some increase in expenditures as well. So that kind of goes hand in hand, but we are fortunate to have that. And then the last method is with a voter-approved tax ratification election or a TRE. So those are really the only ways that school districts have to generate budget capacity. Not a lot else. So just a reminder of our timeline. We'll come back. We should have preliminary values the 1st of May. They're required to report that to us. So we'll update you with that at the next board meeting, along with some additional budget and compensation data. And again, I said the historical data is just here. It's all the same as last time, but it's easy reference for you if it's in the presentation. So with that, if you have any other questions, I'll be glad to entertain them. I was put under pressure. I couldn't do it. It was a challenge.
A lot better than our previous CFO, so we appreciate that. That was on point. I mean, I thoroughly enjoyed that presentation. I hope everybody else did. So.
Couldn't agree more.
I thought so. I thought you might. Any questions, discussion? Ms. Draws, we appreciate it, and we'll see you next time, of course.
I know.
We can move it on?
Yes.
Okay. That brings us to item 5, consideration and discussion related to 2022 summer work hours. Mr. Martindale.
Thank you, Mr. White and board members. This will be brief. I've shared this information with you in transmittal. However, Ms. Hickman is just going to touch base and share with you kind of our plan of operation through the course of the summer. Is a little bit of shift in our hours. So with additional details is our Director of Talent Management, Dr. Hickman. I apologize. Recently, Dr. Hickman.
Thank you. Thank you, Mr. Horak and Mr. Martindale, and members of the board. As Mr. Martindale said, this is just a quick communication to you regarding some summer work hour conversation that we've had for this upcoming summer. So our proposed summer work hours will, usually we have adjusted summer work hours in from Monday through Thursday, and then half days on Friday in the summer. So we are proposing an adjustment to that for this coming summer. And the dates for those adjusted hours would be May the 30th through Friday, July 22nd. And our change would be that the doors for all of our district offices, including campuses, would be open from 7:30 to 5 Monday through Thursday, and then be closed on Friday. So we would essentially be going to a 4-day work week with the same number of hours being worked, just doing that within 4 days. Standard work hours for employees would be 7:30 to 5:30 with a 30-minute lunch incorporated into that. We do recognize there would be a few exceptions. There may be some departments that need to do things a little bit differently in order to ensure that their functions are still being appropriately taken care of. Places like child nutrition and technology maintenance may need to make some adjustments, and those supervisors are currently working through what those adjustments might look like for their employees. We also note that some departments may need to work on Friday just because there may be basic district operations that need to be taken care of, and we will certainly continue to take care of those. And then just the final notation, we also recognize that an adjustment in work hours is sometimes a little more complex if someone perhaps has childcare questions or something like that. And so there may be a few exceptions that we need to work out, but those will be handled specifically with employees and their supervisors to ensure that our district and campus offices are open and that people are working their expected number of hours each week. So that is my short and sweet.
Will you go back to the previous slide? So in past, we've done Monday through Thursday, full days, half day on Friday. What we are moving toward for this summer is in essence 4 10-hour days to give employees Friday off. The 7:30 to 11:30 that is existing on Fridays has a higher absentee rate than the other days because it's a half day on a Friday, and we don't have as much foot traffic on that day as we do Monday through Thursday already. So under significant pressure from administration, we're moving in this direction.
There may have been a pause.
We're at 410s. And this is not out of the ordinary for school districts through the course of the summer.
And I just noticed, this is only through July 22nd, so really
ma'am.
a number of weeks before school starts,
Right.
then
We'll
offices are
transition.
open
Right.
again, right? Probably when parents are maybe getting back engaged with the district.
So our 220 employees, which would include like elementary campus office staff and intermediate campus office staff, come back to work on July the 20th. And so really, once those folks are back, that first full week, we will be back to regular operating hours. So that is exactly whenever we see a lot more foot traffic. All right, thank you.
All right, perfect. Thank you very much.
Very good.
And that brings us to item 6. We're going to enroll consideration, discussion, and possible action related to setting a date for Team of 8 training.
Absolutely. I'm getting this. We've been working on this for a while. Thank you all for completing the survey. There were 3 particular dates that had 7-0 that folks were available. One of those dates that I'm going to recommend to the group was Thursday, August 25th. Where I'm going to check their calendar to ensure, the survey is showing that everyone was available on that date, but I want to confirm. And if that's the case, I would recommend that we do our Team of 8 on Thursday, August the 25th. We would start at 5 p.m. Team of 8 is a 3-hour training. Just for the record, the other dates where I see everyone was available was Thursday, August 18th, and Monday, August the 22nd. And that is, we start school that just a little, I think the 17th. So I thought we might stay away from that. We also have a regular August meeting that week as well. That's why I'm recommending the 25th, so that we're not all stacked up into one week. It'd be a 5 o'clock start, yes. As far as you know. You want to call Marissa real quick? See if you're... Is the board available? We'll make this official. August 25th, 5 p.m. We'll put it in the calendar. All right. Thank you, Mr. Horak.
Yep. That will adjourn us, and we will see y'all at 7.